Okay, so I'm back on Broken and Healed with Dr. Jay Bernstein. Thank you for joining us again. Today we have an exciting episode. And there's a question that I think that is really important, not only to me, but to many of the people out there who wonder about these things and whose lives it affects a great deal. And I'm wondering, are there any studies that have been done that really shine a light on what we've come to know as SIDS, the sudden infant death syndrome?
Yeah, there are a few studies. There's one in particular that comes to mind that I'll bring out, we'll talk about. But before we sort of go into the study itself, I want to bring up a point that, um, ER doctors, when they evaluate babies who have had, say apnea, which means they stop breathing, or they turn blue, which usually means they stop breathing. Um, we determine, we do a whole workup and see if there's anything going on, like, sepsis, a blood infection, things like that, that can increase the risk of having these problems in an infant. But, you know, um, apnea, which we think leads to SIDS, is a criteria we use. How long was the apnea? The criteria we use to admit them to the hospital, so that we can monitor them, so that we can, if they do stop breathing and potentially turn out to be a SIDS case, we can keep them in the hospital and give them oxygen, or bag them with it, or intubate them, or do something to secure their airway. But so we, a lot of times, the determination also involves, we're looking at risk factors. So one of the risk factors that's never asked is vaccines. And the reason why it's never asked is because, we don't think that vaccines is a risk factor. But there was a study published by Neil Miller in 2021 in the Journal of Toxicology Reports. And he reports data taken from the VAERS data and from 1990 to 2019. And he looks at over 2,600 infants. Um, and about half of them, 1,048, died of SIDS, and half of them died of other causes. Um, and in this study, they report that the likelihood of, or I should say, the percentages of people, of these babies dying after they receive the vaccine, they look out 60 days after that. And so, in other words, if the vaccine had nothing to do with either dying of SIDS or dying of other causes, there should be an even distribution of them dying after that vaccine. So from the time zero of the vaccine up to 60 days, the incidence of the mortality should be just constant, right? And what they found in this study is that by day three, 50% of these patients died on the third day. Um, and by day seven, 75% died. So between day 8 and day 60, which is a much bigger period of time, that's when you have the remaining 25% have died. So there's something that occurred at the time they got the vaccines that ostensibly seems like it's correlated to the death, and, which implies, it was causation. Um, and that by itself, and by the way, they looked at also non SIDS and non-SIDS, and they found the same results. In fact, for non-SIDS, they found 78% died within 7 days, a little bit higher. And this is not in a vacuum, because there are seven other studies that have been published since 1980 that have shown the same thing. The CDC published a study in 1980. They found 78% died within 7 days, and a number of other researchers as well. Some of the studies showed even up to nine. Two of them showed 90% died within 7 days. So there's definitely some data out there, and this is one of the things we should be asking when determining whether or not we need to admit the patient to the hospital. Sometimes it's obvious, sometimes you don't need to look at risk factors, but sometimes if you're sort of on the fence about it, you look at risk factors. Is it a premature baby, for example? That would sort of lend itself to be, more likely the kid may be more at risk, so you would want to more likely admit that patient. But nobody's asking about vaccines, and I think that's what we should be doing.
I agree. I mean, that's pretty fascinating and significant data. And, what it makes me think is like, okay, I know on the one hand, it's like, what can you do in that moment? It's not like you can take back the vaccine. However, if a parent who has another child at home has just lost a child to SIDS, and one of the factors might be vaccines, then wouldn't that be the very first thing that they would want to know for like their other children and just for their peace of mind for closure, even if it's
Right.
painful?
Right. And the other thing is, there's always this issue that comes up. Is there any biological plausibility? Because most doctors are going to think, they think vaccines, they think, it's just an immune reaction. How's that going to cause SIDS? You got to look at the excipients. You got to look at what's in the vaccines. You have, SIDS is thought to be multifactorial, but there's definitely a large component that's felt to be a neurologic problem. In other words, the children stop breathing. Your breathing center is in the base of your brain, and when you don't have that working normally, then the theory is that you're at risk of SIDS. So, aluminum and mercury are neurotoxins. So there's definite biologic plausibility that the vaccines and the excipients, the mercury and aluminum in particular, may be the causal agent.
Really important. And is there a takeaway that you would give to parents who, um, for whom this is, a question or an issue, or even your colleagues?
Well, I mean, I would just want to know what maybe you need to ask what the excipients are. What's in this vaccine besides the antigen that we're after to protect against whatever infectious disease we're worried about, right? If it's polio, what else is in the polio vaccine? How much of it? Is it aluminum? How much aluminum? What's the maximum recommended dose for example, by the ATSDR, which is a government organization, a government entity? Look at their maximum recommended doses of aluminum and compare your vaccine with those recommendations. And I think you'll be very surprised.
I think that's really, really important advice. And if you want to know more about Dr. J's data and studies on excipients, on mercury, on aluminum, check out our other episodes on Broken and Healed. Thanks, Dr. J.
All right, thank you.